There's been a lot of, I suppose, interest in stem cell therapy, but and a lot of people, I suppose, claim that they do stem cells, especially in various countries. And I think, firstly, probably establishing the credibility of the center that you're interested in stem cell work is important. And the most I suppose the easiest and quickest way to do that is, has the center or the doctors, have they published, any research or work in stem cell therapy in an international journal? And that's probably the easiest way to ensure that, what treatment you're getting is, exactly what they're saying. So the process itself usually involves having an MRI first to establish the degree of cartilage injury. The secondly is the age must be less than 55 years old, because we use what we call bone marrow derived adult stem cells. And so in this case, if you are 70, then your stem cells are 70 as well. So in studies they've shown that patients less than 55 have a better result. So after we establish that your age is less than 55, that the alignment of the knee is neutral, and that the damage of the cartilage is fairly well, it's not generalized, it's fairly localized, then the patient may be a candidate for stem cell therapy. So it actually comes in terms of two stages. So the first stage is whereby we do keyhole surgery, arthroscopy. So we go in, we have a look, we take photographs, we actually smooth down the cartilage, and then we will drill small little holes into the marrow, of that damaged area of the cartilage. After which we will then place a needle into the pelvic bone and aspirate the bone marrow. After that, we will send the bone marrow to the laboratory, which will isolate the stem cells and replicate them. And that takes usually a process of about 3 weeks. And then patient returns and we inject the stem cells into the knee in the clinic in 3 weeks' time. Well, it's still under research. Most of the patients, between 80 to 90%, have so far shown fairly positive results. But that's in the short term. So really we need to look in the 5-year plus long-term outcome. So that's something that you're still looking into, and hopefully that will be a promising option for patients.